Dr. Mena, what are some conditions or diseases that affect the spine that might require an injection to ease the pain a bit?
So it can be, the most common one that we see on a daily basis will be disc herniations.
Okay.
The disc are this soft tissues that we have in between the bones themselves. They typically, they are the first one that degenerate. They're the more common to cause problems. So they tend to slip out, come out, and cause pain. Good news is that the condition itself has a favorable prognosis. So a lot of times the disc herniation tends to get reabsorbed by the body itself. So when we do the injection, a lot of patients, they have a good outcomes from these injections because we're bringing the inflammatory process down, so the body itself can take care of the rest, which is regressing the disc herniation. Now, other conditions that can cause back problems will be the joints in the back, which they're not being visualized over here. We are called the facet joints. They can become arthritic, like the shoulder, like the knee, like the hip, and they can be a source of pain. Other ones will be stenosis or narrowing, where it's not being visualized in the image in here. So basically the space where the nerve are running or are going down or coming out from the spine, it gets tight, they can get tighter. Because of the buildup of arthritis, they can pinch up on those nerves and they can cause leg problems. And those are often another common thing that we do injections for.
Now, Dr. Mena, can you show us on the image there, where would the injections be placed?
The injections, depending on the area, so there's different injections that we do. It also depends on the area where the problem is coming out from. So we see the patient, we see the image, they match, and we go ahead and we do the injection. So depending on the area, so if it's an injection for the disc and the nerve, basically we put the injection somewhere around here in between the different segments. If it's for the joints are not they're not been visualized over here in the back of the spine over here. If it's it's a procedure that we need to do a disc injection for, we call it discography, we go ahead and put the needle inside this structure here, which is called the disc. So depending on where the structure is, we go ahead and we place the injection using direct X-ray guidance.